Neural flossing, in particular the sciatic nerve, or the posterior branch of nerves, really. So the most distal part of the body that you can get to. So with this, we're going to try and break down any nodes that form within the myelin sheath that contains the nerves. So just like dental flossing, you're going to try and sort of pull the nerve from one end, so your foot end, whilst relaxing it from the other end, so the head end, and then do the exact opposite. So as you pull back with the head end, you're going to release it from the foot end. That's going to try and help the nerve slide and move within that myelin sheath better. The actual flossing part is quite easy once you get the movement right. Just a little bit hard to explain, and then because it's quite an awkward movement. So the first part is the same position as before in the slump test position, which is a slumped upper body whilst looking down and raising your leg whilst putting your toes towards you. That's the initial position. So then to start the floss, point your toes forward. That's your starting point. Then as you pull back with your toes, you look up to the ceiling. So that's then stretching it at the foot end whilst relaxing it at the neck or head end. And then go back to the first position by then relaxing your toes and pointing them forwards whilst stretching the nerves at the head end. So essentially just moving forwards. So as you look down, your toes point down too. And as you look up, your toes point up too. And to repeat that movement, going forwards, then backwards, forwards again, and backwards again. So that's a great way to target the ankle and the knee by only moving the ankle. But if you're still getting symptoms maybe in the knee, hamstring or hip, then you need to sort of change that ever so slightly with replacing ankle movement with knee movement instead. So as you sort of drop the slump position again, straight leg, toes pointing forwards. If that's too painful in your knee or hip, going to bend the knee ever so slightly, only sort of 15-20 degrees. And then as you straighten your knee, as you would do with the foot, you're going to straighten the knee and look up. So that's then stretching it at the distal end or the knee end, whilst relaxing it at the top and on your head end. And as you relax it at your knee end, you're going to stretch it at your head end. So bend the knee ever so slightly and look down. Straighten the knee and look up. Bend the knee and look down.